Health insurance is supposed to protect you, but for countless Americans, it's a nightmare. Denied claims, endless red tape, and life-saving care just out of reach. When the system fails, it fails hard. Recently, the fatal shooting of a health insurance CEO in Manhattan reignited public outrage. While we here at List 25 don't condone violence, the stories behind this anger need to be heard. We've gathered real stories from people who've battled the system and lost more than they should have. These accounts show what happens when profits matter more than patients. I'm Mike with List 25, and here are 25 terrifying health insurance stories. 25. Denied for being too proactive. Pregnancy can be a nerve-wracking time, especially after a miscarriage. During her second pregnancy, Jen recognized the familiar symptoms and rushed to her doctor to ensure her baby was safe. The ultrasound confirmed the baby was fine, and her proactive approach was praised by her doctors. But her insurance company didn't see it that way. They labeled the visit unnecessary and slapped her with a massive bill. Considering that about 10 to 20% of known pregnancies end in miscarriage, Jen's caution was understandable. Apparently, catching problems early doesn't sit well with their bottom line. 24. Treatment, only if you're hospitalized. With chronic illnesses affecting 6 in 10 Americans, I think most of us can understand that managing a rare autoimmune disorder is already a daily battle. For a BuzzFeed community member known as mhiltz44, that battle took an infuriating turn when her insurance company became the real challenge. Her monthly IVIG infusions, which were vital for keeping her condition stable, were suddenly denied. The insurer claimed the treatment wasn't medically necessary unless she was hospitalized. Ironically, this meant they were willing to pay more for inpatient care instead of approving her much cheaper outpatient infusions. Even after years of appeals, she's still left fighting for the care she desperately needs. 23. Anesthesia isn't necessary. Motorcycle accidents are some of the deadliest on our roads, often leaving victims with devastating injuries. Sarah's case highlights how insurance can add insult to injury. After severely damaging her femur in a crash, she was placed on a waiting list for a cadaver bone replacement. When a match was found, her surgery became time-sensitive, but a cold turned into pneumonia just before the procedure. Her anesthesiologist adjusted the plan to accommodate her condition safely, but her insurance company decided the anesthesia wasn't medically necessary. Imagine being told anesthesia isn't needed when your knee is being opened and your femur operated on. Her appeal was denied, leaving her with an $11,000 bill. 22. A costly reroute. Nearly 25% of ERs in the US have closed in the last 2 decades, often due to financial pressures and systemic challenges, leaving remaining facilities increasingly overcrowded. For Monica, this meant her in-network ER was packed, forcing an ambulance to reroute her to a rural hospital. Despite having no choice, her insurance company labeled her visit out of network and stuck her with a hefty bill. 21. A whoops worth $15,000. When you pay $800 a month for health insurance, you expect them to cover your medical expenses. When Emily had her first child, labor complications led to 33 hours of labor, an unplanned C-section, and a 5-day NICU stay for her baby. The bills? Well, $66,000 for Emily and $125,000 for her son. Thankfully, her robust insurance plan with a $750 deductible and $3,500 out-of-pocket maximum covered everything. Or so she thought. A month later, Emily was hit with a $15,000 bill. Shockingly, she called her insurance company, which brushed it off as an error. Oops, sorry, fixed it. Emily didn't have to pay, but it makes you wonder how many others out there have paid for these mistakes without even questioning them. 20. MRI denied during cancer treatment. Dylan's mother was battling brain cancer when her insurance delayed a doctor-ordered MRI, claiming it was, say it with me, unnecessary. See a pattern here? This meant she couldn't monitor how her multiple brain tumors were responding to treatment, an already stressful situation made worse by bureaucratic hurdles. Her family fought tirelessly to have the scan approved, and although they eventually succeeded, the delays caused weeks of fear and frustration. 19. An RN's nightmare. Insurance challenges don't just affect patients, they're a nightmare for healthcare workers too. Alexis, an RN in Kansas, spends her days battling insurance companies to get critical procedures approved for her patients. Just think about it. Can you believe insurance would deny open heart surgery or hospital stays for resuscitated cardiac arrest patients, labeling them as not medically necessary? Well, that's what she has to deal with every day. Getting approvals isn't straightforward either. Alexis's hospital often has to bring in physicians or even hire outside companies to override denials, which adds unnecessary costs. Some days, the stress of fighting these arbitrary decisions makes her feel physically ill, but she refuses to back down, knowing her efforts might be the only thing standing between her patients and the care they deserve. 18. When pain relief isn't a priority. During Emmy's senior year of college, her husband, then a 23-year-old student teacher, was hospitalized for a pneumothorax. The treatment involved cutting open his diaphragm and inserting a plastic tube into his chest. He spent 5 days in the hospital, unable to get out of bed, and faced a grueling recovery that left him sidelined from his graduate studies for over a month. Shockingly, his insurance refused to cover the pain medication he needed to recover from the invasive procedure. They also denied coverage for the x-rays and scans that led to his diagnosis and treatment. Despite countless calls and appeals, the denials kept coming, until Emmy's mom, a lawyer, stepped in. She used her expertise to force the insurer's hand, finally securing coverage. Today, 30% of Americans report delays or denials for necessary medical care, and many don't have the resources to push back. 17. Pick an ear, any ear. Ben's insurance company told his family that hearing in both ears was a luxury. No, I am not joking. Despite his 90% hearing loss, they agreed to cover surgery for just one of his ears. His mom refused to accept their decision and fought tooth and nail for both surgeries to be approved. Today, Ben is a musician, something that would have been unthinkable without his mom's persistence. 16. RSV? Not an emergency. What kind of medical system do we have if life-saving care for a struggling infant can ever be considered unnecessary? Karina's newborn tested positive for RSV at just 3 weeks old, a virus that's especially dangerous for infants. With low oxygen levels, difficulty swallowing, and an inability to clear mucus, her baby was sent straight to the NICU. Her baby recovered after a tense few days, but the relief was short-lived. Her insurance denied the claim, calling the life-saving stay medically unnecessary. Karina, like thousands of patients facing RSV hospitalizations each year, is still battling the system. 15. The cost of denying recovery. 3 weeks postpartum, Jessica was in extreme pain and battling a kidney infection that nearly led to sepsis. Her doctor decided it was medically necessary for her to extend her maternity leave, but her insurance refused, forcing her back to work to avoid losing her job and health care. The strain took a devastating toll. Within weeks, Jessica was diagnosed with postpartum psychosis and bipolar disorder, conditions she never had before. Unable to recover properly, she now lives with a lifelong mental health disorder. 14. Asthma isn't cheap. Over 27 million Americans live with asthma. It's a manageable condition with the right care, so you'd think insurance would cover life-saving medications. For Mary and her son, that wasn't the case. Their insurance refused to pay for rescue or preventative inhalers, forcing them to share one rescue inhaler. When Mary suffered a severe asthma attack, the inhaler ran out, and she landed in the ER twice before being hospitalized for a week. She thought she was going to die. The truly terrible bit is that her insurance covered the hospital stay, but not the medication that could have prevented it. 13. A child's medicine denied. Families shouldn't have to gamble with their children's health. Sarah's 3-year-old son has a metabolic disorder, and they have to control his ammonia levels. Without his compounded medication, those levels can spike, leading to severe symptoms like brain damage or even death. Their issue is that the main ingredient is FDA approved, but the compounded version, necessary because he can't swallow pills yet, isn't covered by their insurance. After he had to go 6 weeks without it, he was hospitalized for 2 nights until doctors could stabilize him. I mean, it really is common sense that his hospital stay could have been prevented if he had his medicine, but you know what? Common sense doesn't seem to be a main feature when it comes to healthcare. I guess it's just not medically necessary to have common sense if you work in the insurance industry. 12. Cancer care delayed. Studies show that even a 1-month delay in cancer treatment can increase mortality risks by 6 to 13%, depending on the type of treatment. Leslie, a patient from Minnesota, experienced this terrifying reality firsthand. Diagnosed with a rare form of cancer in 2023, she underwent surgery and radiation, which put her in remission. Her oncologists, 5 specialists across 3 states, unanimously agreed that long-term hormone blockers were critical to prevent a reoccurrence. However, her insurance company denied coverage, claiming the treatment wasn't medically indicated. Haha, I got you there, slightly different. Leslie lived in fear for weeks, helpless against the possibility of her cancer returning. It was only after her doctor fought for peer review that the treatment was finally approved. 11. A scoliosis surgery debate. When Jean's 12-year-old daughter needed spinal surgery for her severe scoliosis, the family knew time was of the essence. Her orthopedic surgeon warned them that without the procedure, she'd probably need a wheelchair within a year. But when Jean submitted the claim, her insurance company called the surgery elective and denied it. Jean and her family spent months fighting the decision, going through 2 appeals before finally getting approved. Although the surgery was successful and her daughter recovered, more surgeries are likely in the future, so their battle with the system is far from over. 10. A second chance abroad. It's not a comfortable question, but it has to be asked. Why does Canada care more about our wellness than our own government? 9% of the US population, that's 28.8 million Americans, will experience an eating disorder in their lifetime, yet treatment remains out of reach for many. Jessie developed an eating disorder at just 13, but her parents' federal employee insurance didn't cover eating disorder treatments. For years, she endured cycles of binging, purging, and starvation without access to professional help. After high school, Jessie moved to Canada for grad school and enrolled in a free treatment program. With a dedicated team and supportive group therapy, she has achieved complete remission in just 18 months. 9. Pacemaker Price Tag. In 2018, an anonymous patient needed a $285,000 pacemaker surgery to save their life. Despite paying for insurance that promised full coverage, the claim was denied. The patient had to navigate through months of appeals. After 6 months, an advocate at work stepped in and the insurance eventually paid, but the experience left the patient emotionally drained and frustrated. So many people are forced to fight for care when they're already at their most vulnerable. Sadly, legal assistance isn't that easy to come by for everyone. 8. When bureaucracy turns deadly. For one grieving husband, the fight with insurance came at the ultimate cost. His wife, relying on daily doses of morphine for chronic pain, began suffering from toxic buildup as the medication accumulated in her system. Despite her doctors recommending a switch to safer alternatives, the insurance company demanded more reasons before approving the change. The delays stretched on, and the consequences were tragic. She passed away last year from morphine toxicity. 7. Even doctors aren't exempt. One of the horror stories we uncovered came from the daughter of a doctor with a pre-existing condition who found himself trapped in his state's high-risk insurance pool. He had to pay 30% of his income for coverage. As the only specialist in a 75-mile radius, he worked tirelessly in a rural community, often accepting vegetables or piano lessons as payment when his patients couldn't afford care. When he suffered a stroke, the system he served so selflessly failed him. After 4 days on life support and a $350,000 medical bill, including a $70,000 helicopter flight, a man who dedicated his life to the care of others passed away completely broke because of healthcare costs. 6. Drowning in red tape. When heart failure landed one man's father in the hospital for a week, his condition was dire. His lungs were filling with fluid, and without immediate care, he was guaranteed to die. And yet, despite the obvious urgency, the insurance company decided his hospitalization wasn't medically necessary and refused to cover any part of the ultimate 6-figure bill. It took years of appeals and relentless fighting before the family finally won the case. But the stress and uncertainty compounded the pain of an already terrifying experience. 5. A double tragedy. In 2008, one patient faced a nightmare no one should endure. After being airlifted to the Mayo Clinic for a ruptured intestine caused by Crohn's disease, they spent a month in the hospital, leaving with no colon and barely surviving the ordeal. While still recovering, their wife received devastating news. Their baby, at 8 months, no longer had a heartbeat. Labor was induced, and they buried their son. As if the emotional toll wasn't enough, the bills came rolling in. $110,000 for the hospital stay and $20,000 for the induced labor, both denied by insurance. Months of daily calls and relentless fighting reduced the total to $12,000, but the damage was done. The system made their ordeal infinitely harder to bear. 4. An endless loop of denials. For over a year, one woman's doctor has been fighting to get her an MRI for her hip, only to face repeated denials from her insurance company. The reasons? Well, first, they claimed she needed x-rays. Those were submitted and they reapplied. Then they said that she hadn't tried physical therapy. Evidence of 7 years of unsuccessful PT was provided, and again, they reapplied. Finally, the company circled back, insisting she needed to do x-rays first. This endless loop of AI-driven rejections has left her stuck in limbo, unable to get the care she desperately needs. 3. Debt beyond the grave. When his first wife passed away, one man thought the pain of losing her would be the hardest part. Instead, her insurance company dropped her coverage immediately after her death and sent him a $230,000 hospital bill for her final week on a ventilator. Despite the fact that he wasn't legally responsible, the bill went to collections and ended up triggering years of harassment. Debt collectors called him, his workplace, his son, and even his sister. 8 years after her death, he was still receiving notices in her name, summonses to court, and even one for her arrest. It ultimately took a sheriff with common sense and a death certificate to finally put an end to the madness. 2. Too expensive to live. For one woman battling kidney failure since childhood, the healthcare system delivered a devastating blow in 2009. After 15 years on dialysis, she had to stop working as a teacher due to complications and apply for insurance. But at the time, insurers could deny coverage for pre-existing conditions, and every single company turned her away. Without insurance, there was no way she could afford dialysis, the treatment keeping her alive. Her life wasn't worth the cost. If it weren't for the Affordable Care Act passed in 2010 to prevent insurance companies from denying coverage for pre-existing conditions, she wouldn't have survived. 1. No help on the line. Have you ever had a medical claim denied? What happened when you called the helpline? You probably hoped for answers, maybe even a little help. But what if the person on the other end was just like one Redditor's sister? A contract worker with no knowledge, no authority, and no way to escalate your claim. During the pandemic, she spent her days reading from a script, denying claim after claim with the exact same lines, while scrolling through social media. In a system like this, the system we're living in, you're often left on your own. Unless you have the time, resources, and maybe even a legal professional in the family, getting your claim might be close to impossible. Now, if these health insurance horror stories left you shaken, here's a question to test your knowledge. What percentage of Americans report delays or denials for necessary medical care each year? Is it A, 10%, B, 15%, C, 20%, or D, 30%? Drop your answer in the comments below and let us know if you've faced similar struggles, or maybe even a rare success story with insurance. And don't forget to subscribe for more shocking, thought-provoking stories. If this video hit a nerve, you'll definitely want to check out our related video on 25 worst facts about modern society. You will not forget this one. Click the link right here, and I'll catch you next time.